Diabetes is a global health crisis. It affects millions worldwide. The number of people with diabetes is rising, and this increase is alarming. Diabetes occurs when the body doesn't produce enough insulin. Insulin is a hormone that regulates blood sugar levels. High blood sugar can lead to serious health problems, which can include heart disease, stroke, and blindness. The World Health Organization calls diabetes an epidemic. It's a major cause of death and disability. The impact is felt globally, but it disproportionately affects low and middle-income countries. The good news is that diabetes is manageable. Early diagnosis and treatment are key. Researchers are working hard to find a cure, and there is hope for the future. There are two main types of diabetes, type 1 and type 2. They have different causes and treatments. Type 1 diabetes is an autoimmune disease. The body's immune system mistakenly attacks insulin-producing cells. This attack leads to little or no insulin production. People with type 1 diabetes require lifelong insulin therapy. Type 2 diabetes is more common than type 1. It occurs when the body becomes resistant to insulin. This resistance prevents glucose from entering cells properly. Over time, the pancreas may not produce enough insulin. Lifestyle factors play a role in type 2 diabetes. These factors include obesity, lack of exercise, and poor diet. Managing weight, staying active, and eating healthy can help prevent or delay type 2 diabetes. There is no cure for type 1 diabetes, but treatments are improving. Researchers are exploring new ways to manage the disease. One promising area is cell therapy. Cell therapy involves transplanting insulin-producing cells into the body. These cells can come from donors or be generated from stem cells. The goal is to restore the body's ability to produce insulin. Immunotherapy is another area of research. It aims to stop the immune system from attacking insulin-producing cells. This approach could potentially prevent or delay the onset of type 1 diabetes. Clinical trials are ongoing to evaluate the safety and effectiveness of these therapies. While more research is needed, these advancements offer hope for a future where type 1 diabetes is no longer a lifelong condition. Section 4. Automated insulin delivery, the artificial pancreas. Managing blood sugar levels can be challenging for people with type 1 diabetes. It requires frequent monitoring and insulin injections. The artificial pancreas aims to simplify this process. The artificial pancreas is a closed-loop system. It continuously monitors blood sugar levels. It automatically adjusts insulin delivery. The system consists of three main components: a continuous glucose monitor, or CGM, an insulin pump, and a control algorithm. The CGM measures blood sugar levels in real time. The insulin pump delivers insulin as needed. The control algorithm connects the two devices. It calculates the appropriate insulin dose based on blood sugar readings. Artificial pancreas systems are already available. They significantly improve blood sugar control. They also reduce the risk of complications. Ongoing research focuses on making these systems even more sophisticated and user-friendly. Section 5. Innovations in type 2 diabetes treatment. Type 2 diabetes treatment focuses on lowering blood sugar levels. Traditional treatments include lifestyle changes and medications. New medications and therapies are emerging. GLP-1 receptor agonists are a class of drugs. They mimic the effects of a naturally occurring hormone. This hormone stimulates insulin release. It also slows gastric emptying. GLP-1 drugs effectively lower blood sugar and promote weight loss. The gut microbiome is another area of interest. The microbiome refers to the trillions of bacteria living in our gut. Studies show a link between the gut microbiome and type 2 diabetes. Researchers are investigating ways to modify the microbiome to improve blood sugar control. These new approaches offer promising options for managing type 2 diabetes. They complement existing treatments and may lead to better long-term outcomes. Section 6. The future of diabetes. Is a cure on the horizon? The search for a diabetes cure continues. Researchers are making progress. While a cure may not be imminent, the future holds promise. Stem cell research is a promising area. Scientists are exploring ways to generate insulin-producing cells from stem cells. Transplanting these cells into people with diabetes could potentially replace damaged cells and restore insulin production. Gene editing technologies like CRISPR-Cas9 offer another avenue for a cure. This technology allows scientists to make precise changes to DNA. In the context of diabetes, gene editing could be used to correct genetic defects that cause the disease or to enhance the function of insulin-producing cells. While significant challenges remain, the pace of research is encouraging. With continued investment and collaboration, a cure for diabetes may one day be a reality.